Okay, so for this video, we're going to do the instructional video for the calcaneus, and we're going to do the planto-dorsal axial calcaneus and the lateral calcaneus. So for these images, we're going to use a 10 by 12 cassette, and my patient is Mrs. Marshall. She's going to take a seat up here on the table, and the first thing I'm going to have her do is remove her shoe and her sock. Okay, so we're going to be able to put a full body apron on her since we're imaging the foot. Okay, I'm going to put a thyroid shield on her also. Okay, and then my patient just needs to swing her foot up here onto the end of the table. Now, since we're just getting the heel, we are going to be able to use this small cassette, and we're going to be able to collimate down pretty far. So for the first picture, we're going to get the axial view first. This one, the way her foot is not too bad. We're going to have it in this direction. So I'm going to put her heel down right in the middle of my IR. And then I'm going to put a 40-degree angle cephalad, which is towards her head, on my tube. And again, there's no detention for this, so we're going to do this exam tabletop. So when I get my 40 inches, I'm going to use my measuring tape, and I'm going to measure 40 inches to the middle of my IR. Okay, and then once I get my tube where I need it to be, then I'm not going to move that again. What I'm going to do is move my patient. So for this, I'm going to have her take her other foot out from this left foot here. I'm going to center her heel right there in the middle of my IR. And then what I'm going to do is move my table to where I need her to be. Okay, so what you're wanting to do with this view is you're wanting to get the foot dorsiflexed as much as you can so that we can see the calcaneus. That can be very hard for some people to do. Some people, like Mrs. Marshall, can probably get it back far enough. And then most people, especially if they're in pain, you may have to use tape, you can use a sheet, you can get pretty creative with ways in order to get them to hold their foot back. So just for demonstrations purposes, I'm going to use some tape, which is probably not the ideal thing to use, but it'll work in a pinch. And so I don't stick this to her foot, I'm going to use the non-sticky part. And I'm going to put it right up here, and I'm going to ask her to just hold the ends. Now, she's going to pull back as much as she can on her foot, which is going to be painful for her, so we're going to try to make her flip. Now, I'm going to put my centering point right at the base of the third metatarsal and kind of in the middle. And then I'm going to collimate down. And this is her left foot, so I'm going to mark the left side on the lateral side. And I'm going to expose this at 70 kVp. Okay, I'll take that. Okay, and the next view is going to be a lateral. So lateral, there is no angle on the tube. You're going to just shoot a straight vertical projection. Now your patient needs to have their lateral side of their foot down on your IR. So you're going to bend their knee. Now I'm going to turn my IR so that the patient's calcaneus is right in the middle. I'm just going to center right in the middle of that. And again, you can collimate pretty close on this because all we're looking at is the calcaneus. I'm going to do about 40-inch SID. I'm going to mark it with my left marker, and I'm going to have her dorsiflex her foot. Okay, and now make sure that when your patient rolls over onto their side that the lead apron is across them. Sometimes it falls off and then it's doing no good. So make sure you have it right across their lap. And then I'm going to go ahead and expose this at 70 kVp as well. Okay, and those are the two projections for the calcaneus.